Rec- Recording in progress.
Okay, I guess I'm going to call this meeting to the Health and Human Services Board to order at 10:32 a.m. on January 13th of 2022. Was this meeting properly posted?
Yes, it was.
Wonderful. And I would entertain a motion. Actually, I'd like to make note that we do have a quorum at this time. The only person that is missing appears to be board member Chicker, Cynthia Chicker. I believe all the rest is here, and we did have that resignation last month, Diane Cox. With that, I would entertain a motion to approve a 14-point agenda. Is anyone willing to make that motion?
Van, I move.
Van moves to approve our 14-point agenda.
Glassbrenner.
Ingrid Glassbrenner seconds. Is there any further discussion on our agenda? Hearing none, all those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. Agenda item number 2 is approve our December 9th, 2021 Health and Human Services Board minutes. Are there any additions or corrections to those minutes? Anyone willing to make a motion to approve those minutes?
So moved. Glassbrenner.
By Ingrid Glassbrenner, is there a second?
Second, Van.
Made by Van Nelson. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, say nay. Motion carries. Next on our agenda is item number 3, agenda item 3, which is citizen comments. Are there any citizen comments? Are there any citizen comments? Any staff members or board members that wish to comment under citizen comments? Hearing none, we'll move on to agenda item number 4, Director's Report. Tracy?
All right, thank you, Mr. Chair. Well, on behalf of our staff, I'd like to wish the board a happy new year. We're looking forward to 2022 being a better year, hopefully with more stable staffing and being able to return to more in-person services for our community once the high level of COVID cases subside again. Fingers crossed. This month, our leadership team will be conducting annual strategic planning meetings over a series of weeks to help us identify priorities for the year and beyond. We've been conducting these types of meetings each January, February over the past 3 years to help us reflect on our status and accomplishments, review our strengths and needs, and to set our administrative objectives and goals going forward. Oftentimes new proposals that come to this body are born out of these meetings that we start the year with. In behavioral health services, we recently completed a choices group for youth who have received underage drinking tickets. The educational program was done over the course of 2 days using the Prime for Life curriculum. Prime for Life is an evidence-based curriculum for youth, which focuses on making safe choices. The treatment court program was awarded the grant that we had applied for. So now the program will be implementing a hybrid model, which will integrate a new drug court with the alcohol treatment court that is already in place. All of our behavioral health programs, including our outpatient mental health and substance use services, the crisis program and the CCS program, successfully completed their recertification process after undergoing an extensive site survey by the DHS Division of Quality Assurance. Preparing for these survey audits are very labor intensive for both our behavioral health staff as well as our admin staff who support these programs. So I appreciate all the work that was done, and it was a successful survey. Child and Youth Services started the year being very busy with several reports and investigations. Our staff are working diligently to meet the needs despite our staffing shortages. Thankfully, we'll be filling one of our case manager vacancies later this month. We continue to use our family preservation worker, Cecilia Degenhardt, to provide services to families who do not meet the criteria to open them for investigations, but are still identified as being potentially at risk. Fortunately, in economic support, we're fully staffed and our new workers are working through their new worker trainings. The new statewide call phone system, Genesis, is up and running. Bugs are being worked out as we go, and we're hearing from some of our workers that they do like this system better than the former CCA system that was used statewide. For the WEAP program, the Heating and Energy Assistance Program, due to the cold weather, we are getting more requests for crisis funds to pay for fuel deliveries and furnace repairs and replacements. We encourage anyone who is thinking they may be eligible to reach out to us to apply for the regular energy assistance program. And in the ADRC, the staff have managed pretty independently during our manager's absence. ADRC manager Roxanne Kluber-Tans-Gerber returned from her medical leave today. Welcome back, Roxanne. We're grateful to have had the support of the regional ADRC director, John Grothin, to assist with during Roxanne's absence. And like economic support, we are fortunate that our ADRC staffing has remained relatively stable with the new staff continuing to complete their trainings and onboarding. And that's all I have for today.
Are there any questions for Tracy? Hearing no questions for Director Thorson. Director Thorson, thank you for your reports. That will move on to our agenda item number 5, which is our health officer update. Rose?
Thank you so much. I'm sure Tracy will share her screen in a little bit to give the board information regarding our most recent Richland County COVID-19 statistics. But I wanted to let the board know that as is occurring nationwide and throughout the state of Wisconsin, Richland County Public Health is also experiencing an increase in the numbers of COVID-19 cases that we are receiving. And if this trajectory continues, it may very soon outstrip our staff's capacity to manage contacting each individual case that we receive. And right now we are looking at alternate methods for communicating essential information and recommendations to folks. And those may take the forms of letters, texts, emails, and things of that sort as well. We may also begin the process of triaging cases as they come in to take a look at those who might be most at risk, depending on certain circumstances that we identify. So just wanted to make sure the board was aware of that fact. I know that this morning when we began the process of assigning cases, we had at least 33 waiting in queue for us. So I'm assuming it will become a heavier lift before it becomes a lighter one. And I see that the statistics are available here. What is important as well to note is that every county now in Wisconsin is experiencing critically high COVID-19 transmission. I've heard about some health departments that have 2,000 cases sitting that they have received, and it's become increasingly more difficult for health departments of every size to manage the numbers that they are seeing. So we are looking at different ways of managing that so that we can be as effective as possible, but yet still preserve the health and mental health of our staff as well.
And Mr. Chair, I'll just jump in and note that this data sheet is available in your iPad folders for the board to review.
Question, Mr. Chair.
Hi, Tim.
Rose, are we seeing the latest cases? Okay, let me start over. Is Omicron the dominant strain in Richland County now?
I would say yes. And the reason for saying that is that while I do not receive specific communication from the Department of Health Services or the Division of Public Health regarding what specific types of variants have been sequenced here in Richland County residents, we, by virtue of information that we have access to from the Wisconsin State Laboratory of Hygiene, where whole genomic sequencing is occurring, we have information indicating that in Wisconsin and in the cases that have been sequenced at that lab, 83% of cases right now are represented by the Omicron variant. And then it also gives a very nice color table in graph form where you can actually take a look at the percentage of other variants which may be circulating as well. But given the reproductive value of Omicron, it stands to reason that it would become the dominant strain and has already, just because of how easily transmissible it is.
Okay, great. And is it safe to say that Richland County is following suit with the rest of the state that that this variant is more efficacious, but is resulting in lower case fatality rate and hospitalization?
Right now, we are seeing some folks who are hospitalized, but we have not, at least in the last week or two, seen an uptick in reported deaths, or the hospitalizations seem to be reduced as well. So I'm crossing my fingers and hoping that that will continue. So hopefully we will also experience that more mild illness in the residents here in our county.
Great, thank you.
Are there any other questions for Health Officer Kohut? Rose, thank you for that update. I suppose you're going to be next on our agenda with agenda item number 6 is approval of our new medical advisor for Richland County Health and Human Services.
Yes, yes. You have had the opportunity to read the board mail out, and the request has been made by myself that the board review the mail out and approve Dr. Neil Bard as our new medical advisor to succeed Dr. Thomas Richardson, who indicated his desire to retire. Initially, he had thought that his last day would be December 28th, but because we have to have an active medical advisor here on board at all times, we cannot have any sense of operations without having that oversight. So if you would be so inclined, and I would graciously ask you to do so, I would ask that you please approve Dr. Neil Bard in that role. He's been gracious enough to indicate his desire to act in this capacity, and we are very fortunate to have a doctor of his caliber step up and choose to service in this capacity.
Right now, a motion would be appropriate to bring onto the floor for discussion, having Dr. Neil Bard be the health advisor for public health, Richland County's public health. Anyone willing to make that motion?
I'll make the motion.
A motion by Dr. Barris. Is there a second? I will second for discussion. Is there any further discussion? Is there any discussion at hand? The motion is to approve Dr. Neil Bard as the new medical advisor for Richland County's public health. Is there any further discussion? I'll call for a vote. All those in favor signify by saying aye.
Aye.
Aye. Those opposed say nay. Motion carries.
Thank you.
Next on our agenda is agenda item number 7, expenditures report, vouchers and expenditures over $2,000 but less than $10,000. Stephanie?
Yep. Hi, everybody. So I did go through these with Clint yesterday and he approved them and the checks are being cut as we speak. So I'm just gonna go ahead and review what I went over with him just so you continue to have a kind of an idea of the expenses here. So if we, page 1 and 2 are, if you scroll down to page 1 and 2, those are just our monthly mileage expense reimbursements for our volunteer drivers. And then if we go to page 3, all of page 3, and then if you go to page 4, most of page 4 are credit card charges. To highlight a few of those, not too much on page 3, but on page 4 there, you'll see $720.01. It's item number, was it 62? That I believe is the, I don't believe, I know, was for some ADRC furniture for the lobby there, some new furniture, a couple of chairs. If we go to the $1,389.76 and the $347.44, that's just our monthly charge for Cario, our electronic health record system. And then the $2,119.80, just below that, item number 48, that was for cubicle extenders in the economic support unit. That was an expense over $2,000 approved by Clint. And now we're finally paying the bill on that. If we go to page 5, sorry, page 5, you'll see that that's all CDW government. Most of that is just for miscellaneous computer items, screen adapters, UPSs, laptop bags, wireless mice. We had to get some DVD burners for the children's unit to go with their laptops because their new laptops didn't come with DVD players, and they need the DVD players to do their job. If we jump to page 6, we have our monthly photocopy bill, $336.13. The JComp Technologies was for, I have this, docking stations for the ADRC laptops, the $1,659. They needed docking stations for, they had to upgrade their docking stations to go with their new laptops. And then there's a big chunk here for language line. The total for language line this month was $1,172.15. And I think, Angie, that's higher than normal, isn't it? Yeah, that's higher than normal. But what we did is you'll see a charge for $214.85. And then another charge for $780.42. And that was for a variety of documents that needed to be translated for public health and behavioral health, flu vaccine forms, HIPAA forms, consent forms, various forms that we needed to get translated. If we go to page 7, pretty much the top half of this is for Quill, and the bulk of those I looked that up, and the bulk of that was for copy paper for the most part. And then the Richland Observer is the bottom half of page 7, and then the top half of page 8. On page 7, those charges were for a variety of ads for ADRC programs and the outreach that needs to be done for those programs. And then the rest of the on page 8, the rest of the Richland Observer ads were for hiring for vacant positions. And there on page 8, the $2,164 books and forms item 38 to the Richland School District is we use substance abuse prevention dollars we pitched in to help the school district purchase parent handbooks for the middle schoolers. So then if we go to page 9, the $433 for Wirtz Plumbing and 12 cents for Wirtz Plumbing item 42 was hopefully our final bill on the urinal repairs that had to be done. All right, and so just note that the items that I just went to, those are all bills that are going to be charged to 2021. We already had a couple of bills come in that are starting off 2022 already. We had the Behavioral Health Training Partnership annual fee come in that we needed to pay. We belong to a statewide training partnership, and this gives behavioral health unit staff access to online training year-round. And then we had a couple of rent payments that were due for our meal sites. And then finally, page 11. Page 11 is previously paid vouchers. These are vouchers, again, that we pay because they have due dates before we have board meetings. But just a couple of the ones to highlight up at the top, Infinity Training, the $1,850 was for let me scroll down here. That was for a trauma-informed care training that was attended by several staff, and it was funded by the CST program. That's item number 1. The items 2 through 9 are just our standard. We pay those monthly. And then items 10 and 11, these expenses were also approved prior to this meeting by Clint. Clint approved these. We put requests through to him, and he signed off on them. And we wanted to make sure that these got paid in 2021. And the first one is it's a fire alarm project. We're updating the fire alarm, doing some updates to the fire alarm system here in the building. And the Strang Heating and Electric is for some cabling that we're doing for all the security cameras. We had to get some new security cameras, and we needed to upgrade all the cabling to go with that. So these are items that have already been paid. So yeah, so
Excuse me,
go ahead.
Stephanie, I just wanted to add in on those 2 items that Stephanie's mentioning. those were items that we knew that were needs. They were not budgeted in our 2021 budget, but because we could foresee that there'd be some remaining funds, that this was our opportunity to take care of those needs.
And that's my report for this month. Any other questions? Great.
Let's move on to our next one, agenda item 8. Budget summary and Richland County placement report.
Okay, great. All right, so for this month's budget report, we are in December, so we should be at 100% of our budget utilized. I think what was interesting is we really got a lot closer to 100% in quite a few of the areas. I really looked at what happened from last month till now, and December was a 3 paycheck month. So that really brought us up to where we needed, a lot closer to where we needed to be as far as 100%, especially if it was a staff related expense. And then otherwise, I think noting that public health expenses, they're at like 153, as you can see, they're at 153%, but this isn't a surprise to us. It's been trending, it was trending high all year due to all of the extra COVID times, staff time spent on contact tracing and things like that. But again, that's revenue that we do have revenue to offset that increased expense. And then as you can see from last month, you've seen an increase in the use of the transportation and the nutrition services. Their utilization is increased. So the utilization is a little bit higher. ESS programs, again, they're closer to 100% utilization, again, due 3 paycheck month, but then also too, they were fully staffed the whole month of December as well. So that brought that up. Children and youth services, the contracted services, that is just, sorry, my notes are out of order here. The CPS Contractual Services, same as in the past, just simply a lower use of contracted services. And we can say the same for the AODA and treatment court, as well as CLTS. Service utilization is just lower. If we go down to look at APS, Adult Protective Services, the primary reason for that being so low is we weren't able to fill the APS crisis position this year, and the 100% APS position remained vacant for quite a bit of the year as well. And birth to 3 therapy, you can see that's over 100%, but that was actually higher due to the loss of our contract for services out of the hospital. So we had to pay more for services from different agencies. So that's column 1, talking about expenses. If we jump over then to the core budget balance, it looks like I didn't change that date up at the top there. I apologize. Core budget balance it says through October. It's not, it's through December. So I apologize for that. And so if we look at, so you have our actual expenses. We have some anticipated expenses. Every month we can expect additional CCS expenses and those kinds of things. So we build that in. And then with the revenue we've already received this month, and then also adding in anticipated revenue, our budget balance is about $138,948. That's where we're at, based on AS 400 and any kind of anticipated expenses and revenue. The one thing to add about the revenue, the anticipated revenue, is the positive balance that we see here is also as a result of receiving WMCR amounts. Since last time we have received our WMCR. We received one of our WMCR payments. We received our CCS WMCR payment, which was $107,000. And then we are supposed to be getting a check for our outpatient mental health and our crisis as well. So that'll be another $63,000. So that's going to be, that's what's helping with our new core year end projections after we put the chargebacks back in. Another unanticipated expense or a bit of revenue that we received was there's some, the county received some rural healthcare funding from Medicaid, and so a portion of that will come to us as well. And that amounts $96,000. So this is kind of where we're sitting at right now. Again, until everything completely closes, these are just projections at this time. Does anybody have any questions?
If I could just add in, Stephanie, so that $138,000 here is before the institutional costs that landed in our Fund 56 were taken out. And after they're taken out, the picture actually gets better. Stephanie's projecting us at about $336,000 of remaining funds. And as I talk about the placement expenses, that number will be important. So I can move on to the placement reports if nobody has any additional questions for Stephanie. All right, well, jumping over to looking at the placements for adult placements, and a reminder that this will reflect only through November. We're still getting those December expenses in. We do know that we had a higher month in December than we have typically seen, so we are anticipating more expenses to come in. For adult institutional and inpatient placements, our total expense through November is $142,364. Crisis stabilization expenses, we haven't seen any expenses since September. Our total currently is $49,007. With adult community residential placements through November, we are seeing $387,699 in expenses. So for Fund 54, which is our adult placement fund, we started the year with $482,278. Total expense in Fund 54 through November is $579,070. So that puts that fund in a negative balance for $96,792. For child placements, for child institutional, inpatient, and detention placements, our detention expenses through November was $23,400. The child institutional expenses was $189,392. And then looking at our community-based placements, youth group home and treatment foster care expense was $400,361 through November, and regular foster care was $27,942. So for Fund 44, which is our child placement fund, we started the year with $527,341. We have so far through November had $641,033 in expenses, and that fund is left in a negative balance of $113,692. I'll switch over to another chart to show you. So this chart again shows the monthly placement expenses. The dark blue is 2021, and the lighter colors are previous years. So you can see if you look over at the dark lines per month, you'll see that generally we've had lower expenses in 2021. And then looking at the projection and the comparison of previous years. So with 1 month remaining, we are projecting to end the year at $1,331,000 approximately. You'll note that Stephanie's remaining estimate for the year is about $336,000. So right now it is looking like we are going to be able to cover that deficit from our core budget. And then just to share with you the different placement types, how we are projecting those to end the year. So adult, institutional, and inpatient looks to end the year at a maybe not an all-time, but a low number compared to previous years. It looks like we'll end around 155,000. And the reason that's low is because we had a pretty high placement costs there in previous years that we are now able to use a community placement for. So you'll see that our adult community placements is ending, we're projecting $422,000 in expenses, but much of those expenses we're able to claim against Medicaid dollars through the CCS program. And so that's why we're kind of seeing that we will have funds hopefully to cover what's remaining in the institutional expenses. Crisis stabilization, which we've been working to utilize to help either shorten hospital or inpatient stays or divert from the need. We look to end the year about 53,000. And then in the children's types of placements, the child institutional residential treatment looks to end the year about 206,000. That's stayed relatively steady over the years. Juvenile detention looks to end the year about $25,000. Group home and treatment foster home, we have seen a significant increase in expenses in that area for children who have needed either a treatment foster care level of treatment. We look to end the year about $436,000, and regular foster care looks to end the year about $30,000, which has stayed relatively steady for the last 3 years. And I believe that's the report for placements, Mr. Chair.
Are there any questions or concerns with our placement costs?
Mr. Chair, if I could just ask, Tracy, do you, I mean, this is probably a difficult question to answer, but do you have any idea why the significant jump from 2020 and 2021 for the group home and treatment foster care? It's $200,000 jump.
You know, I'll share what I understand, and Jessica, if you have anything to add, please do. But we have had much more significant placements where we haven't been able to utilize regular foster care, which is substantially less costly. And so I think with an effort to try to keep some large family groups together, as well as, so if one child in that family group that needed to be placed has high needs that reach that treatment foster care level of care need, we've kept the whole family together in that placement. Jessica, is there anything you would add to that?
No, I think we've run into a lot of situations additionally that it's like those chronic recurring families where there aren't appropriate relatives to place the children with. So we're having to resort to those foster and treatment foster agencies. We've also had a couple of youth who have utilized detention and then stepped down to group home settings, which we haven't had in the past couple of years, a couple of juvenile delinquency youth. And we just had a kind of a several year period where we didn't have a lot of youth justice placements or that type of placement need. And it's just arisen in the last year or so.
Are there any further questions?
I guess one further question, and I'm trying to figure out how to state this because I don't want it to sound, I know that you guys have struggled to have enough staff in that department particularly. Do you feel like that impacts this at all?
I would say that it does, just because when you have more seasoned staff, they can make better determinations about levels of risk. And it also, when we are fully staffed, we have more capacity to provide kind of more frequent contact with families and more frequent supports for families. Generally, I guess the conventional wisdom is if you have longer term staff and you have sufficient staffing, that you have lower placement costs.
Okay, thank you both.
Any other questions, concerns? Thank you, Tracy, for that report, and Stephanie. Move on to agenda item number 9. We got 2021 contract monitoring report with Mrs. Reisner.
Morning. There it is. Okay, so monitored this month for November is really what the invoices were coming in. So we'll still have probably 1, if not 2 more reviews, 2021 contracts before we get into 2022. So on the first page, on the far right, we're looking for anything that's over 92% utilization. So 4 from the top is the Children's Hospital of Wisconsin, and that is later on the agenda is something that we will have to be amending, which is very similar to what Ingrid had just brought up. That same provider is we're overutilizing. Right below that is Chelita. They have billed us though through December. So it's the same with Children's Hospital, the one just above, but we're still obviously exceeding the actual contract we have approved for the entire year. So those are the 2 on page 1. You go on to page 2, right in the middle is Artisan Shop. I've been mentioning this every month. It's over the 92% utilization. I've put that they've billed us through December because we don't plan on using that provider anymore. So that should be just fine. Page 3, right in the middle again, Premier Financial Management Services. Every year, this is one that we have to clean up. Not doing it this month because we haven't seen bills come in for the end of the year yet. And that is one of the Children's Long-Term Support pass-through accounts. So I would guess probably in February, we will have more of a realistic total dollar amount that we need to amend that to. So Lori Cooey and I are working closely on trying to figure out what that dollar amount would be for 2021. And we'll come back and amend that appropriately. Page 4, I don't see any issues on there. Page 5, right at the top is Cario. Billed us through December though, so that one should be just fine. It's one I mention every month. Page 6, everything looks in order there. And page 7 just has one little contract at the top, and that's obviously not utilized. So that's what I have. Any questions for the 2021? Like I said, it'll be another month or so that I'm wrapping up 2021 before we actually give you any information on 2022.
Any questions, concerns? All right, let's move on to our next agenda item, which would be agenda item number 10, approve contracts, agreements, and amendments.
I did just put in your folder updated, actually, I think it was later last night. There was on page 2, there should be an additional one towards the bottom. But right at the top is that Children's Hospital of Wisconsin that we've been talking about. It was amended once before, but just as she has mentioned, that increased need for treatment, foster care, and respite services is why we need to amend this again. I did put it on for county board already for next Tuesday.
So this is what the Children's Hospital of Wisconsin, the first one, and then the second one is Chelita. Can we do those both at the same time?
They're different years, so I would say you need to approve them separately. That's why they're in different blocks.
Okay. A motion would be appropriate then to approve our first amendment to the Children's Hospital of Wisconsin. Anyone willing to make that motion?
I can make the motion.
The motion
Second, Tim.
by Ingrid Glassbrenner, and then there's a second by Supervisor Gottschall. Is there any further questions or discussions with the Children's Hospital of Wisconsin? Hearing none, all those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. Next on the list is Chelita Institute, who's it's Miranda.
Actually, no, that's Jess again. So this is for 2022. Jess, go ahead.
So this is just our original contract for this, for placement of one youth at this facility. This has been an ongoing placement of this youth. So we're just recommending the contract amount of $230,000, which has been sufficient to cover our costs historically for this youth and would allow for the youth through the entirety of the 2020 youth calendar year.
I think we're asking to amend the contract up to 255,000.
Yeah, yes,
I think
it's due to the,
we may have gotten the rates and.
yes.
Yeah, sorry. So originally I had proposed 230,000, which was sufficient to cover this past year. However, the state allotted additional finances to each of the residential care facilities. So we did increase to 255,000 per our request to cover the 2022 calendar year. Again, we did not receive the state approved rates for these facilities until the end of November. So we went with the previous year rates in our initial request.
So you heard our report on why Chelita Institute needed to be increased funding. Is there a motion to approve? Send this on the county board for approval?
That one doesn't need to go on to county board. It's within that 15%. They already approved the 230,000. And then I just did the calculations and it's under the 15% that we can go just to this board with amendments.
Is there a motion for approval?
So moved, Tim.
Motion by Supervisor Gottschall. Is there a second?
Second.
Second.
Seconded by Dr. Barris. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Say nay. Motion carries. New contracts and agreements.
So then those are down at the bottom for 2022. The first one is just a name change. Gotta love those. It happens a lot though. So we have to get new approval again for, I can't send the contract out to Hope Haven, Rebos, United anymore. Now they've renamed themselves Catholic Charities, doing business as still 5 Door Recovery, but it's a name change. Community care programs is something new for Jess.
The community care programs is a provider who offers psychosexual evaluations out of the Dane County area. We had a youth that was court ordered to participate in a psychosexual evaluation at the end of last year. So we are just pursuing this to be able to contract with this provider to do the required court ordered assessment related to their youth justice charges.
And then if you continue down, there should be, we're on page 2. There we go. So then Family Support Services, another new provider for 2022, Jess?
Yep. So Family Support Services is a provider closer to the La Crosse and Westby areas. We're working with a couple of families over in that area. And it's actually easier to contract with them for parenting services and some increased supervised visitations to be able to offer reunification efforts to families versus, so it's more cost effective for us to utilize this provider in that area than it is for our staff and our family preservation worker to be driving to that area to provide the additional services. So some of this will be funded by our safety services funding that we are approved to receive to provide those additional extra services to a couple of families that are in need of increased visitations or more supported supervised family interactions just due to their own level of capacities. So we found this provider. They have worked with a lot of families in other counties and currently serve Crawford and Vernon counties in the same capacity. So that's why they got recommended to us to utilize.
And the last one is for behavioral health, Miranda.
Okay.
There she is.
Mirama Behavioral Health is an inpatient hospital located in Middleton, so just a little closer location. If we are able to get patients accepted there that are needing hospitalizations, then they're having law enforcement do the transports all the way to Winnebago. And it actually is a little bit lower daily rate than Winnebago as well, so a nice contract to be adding on.
We can take all these new contracts together, correct?
Yes.
Okay, a motion would be appropriate to accept these 4 new contracts.
So moved.
So motion by Supervisor Glassbrenner, is there a second?
I'll second, Van.
Seconded by Supervisor Nelson. Is there any further discussion? I guess I have one discussion on the family support services. So is this a primary residence of Richland County, this family, and they have a family member that lives in Vernon County? Is this how this is working?
Yep. So the actual placement resources are out of county. So in one case, we're utilizing the youth is placed at Chelita, which is in La Crosse. So they are just better capable of servicing that area to provide the visitations for that family. And then the other family that we're looking at them serving is actually a youth who's placed with a family member, and the family member is a resident of Vernon County. So it's closer in proximity to have this provider be providing that services to the family than it is for our service providers or our in-house family preservation worker to do that transportation and service.
And yes, these are Richland County residents. These clients are Richland County residents.
Yeah.
All right. Any further discussion? Hearing none, I'll call for a voice vote. All those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. So next on our agenda is agenda item number 11, personnel updates.
All right. Well, we are happy to announce a new hire of Marjorie McGraw for the Child and Youth Services. She will be a case manager starting on the 24th of this month. Also, some completion of probationary periods. So Connie Ostrowski and Crystal Adams, both of economic support, will, I guess, as of yesterday, completed their probationary period. We did get a resignation of Sonia Klang, who's a nutrition site worker. She actually resigned a while ago. I guess we're cleaning up our roster here. I think we had missed that before. And then with some of our lease staff, Alice Lawrence Rettram, who had been a psychiatric nurse, she had been a county employee and then agreed to stay on as a leased LTE staff to help us out, and she is now finished. That ended December 17th. Betsy Ressler also ended her work with Health and Human Services at the end of the year, so she was done on the 31st. And we're happy to report that Laura Radeska, who has been with us sort of on and off, has been able to return. So she was rehired on the 5th of January. And then a couple of leaves to report. We have Kelly Mormon and Connie Ostrowski, who are newer staff, needed some unpaid leave time. And I guess I could jump down to just letting you know where we stand with our position vacancies. We do have a secretary position for our admin unit. We're currently advertising. We are still trying to recruit a driver for the ADRC. We have a few positions with behavioral health, the CCS supervisor, the APS worker, the APS crisis professional, mental health therapist, and psychiatric nurse positions that we're currently advertising for. We are in the interview / decision-making process for the child and youth supervisor position. And all remaining positions are on hold because they're not included in our budget. I think that's all we have for personnel updates, Mr. Chair.
Thank you, Director Thorson. Are there any questions or concerns regarding our personnel updates? Moving on to agenda item number 12 is our quarterly review of Health and Human Services organizational chart. Something Angie's gonna take care of?
Yeah. So this is as of January, just recently updated this. So page 2 starts with administration. I'll only highlight those that have changed since the last time we reviewed this. So the second column down is a vacant secretary position. That's the one we're still trying to fill. As well as to the right of that is Maria Janet Perez. She has been hired on to assist with cleaning in the building the last few months. Page 3 is the ADRC. First column, third position, Nicole Gaudette is a social worker that transferred from the Child and Youth Services position that she had over into the ADRC and now is an INA specialist. As well as second column, second person, Kayla Williams also transitioned and transferred from Child and Youth Services position over into the ADRC and is now a disability benefits specialist. Page 4, behavioral health services. And I know this one can get kind of hard to see. There's a lot on there, but right under Miranda, there's that first line and there is some vacancies there since I last reviewed this with you. And the second block is the CCS supervisor. And then if you go all the way over to the far right is the adult protective services worker. We had an individual in there for about a month and then resigned as well. So those are largely on that row. We're advertising pretty frequently for all those positions right now. Then if you go to the left, blue block mental health outpatient clinic, you'll see there third column, second down, Diane Cox. We had brought her back as an LTE APS consultant, as you're all aware of. And then under the CCS blue block, the third column on the right is Kelly McGann. She is now a psychiatric RN that we hired full time. And then right below her is Laura Radeska, who just came back again. Page 5, that's all pretty stable. That business and financial services positions unit. Page 6, this is child and youth services. So this is where there's some vacancies based on the transfer of positions. So the far left block, the vacant child and youth services supervisor position. We may have some activity with that. So that'll be filled in. Right below that is Emily Phelps, is a new case manager we recently hired. And then all the way over on the far right, there's that other vacant position that actually Marjorie that we just announced will be filling in. But I do these reports based on today and she hasn't started yet. So the next time she'll actually be in that block for you and you'll see her in there as well. Page 7. Couple changes, like Tracy had mentioned, ESS is fully staffed now. So the second position in is Amanda Oman. She was recently hired, as well as first column all the way down, Darian Ostrowski was the other vacant position. We had 2 economic support specialist vacancies that were recently filled. Page 8. This is the left side is that additional COVID pandemic response positions. I've updated that because we had some turnover, had some people not doing certain additional work and things. So that's been updated, as well as I think the far right, where is largely more of the public health traditional workload. That's where Betsy Ressler was removed, as well as under the Germantown meal site, we now have 3 vacancies down there because of the recent resignation that we received, but it was actually, she hadn't been working there since 2019. So, and that's all I have for positions. And I'll continue to offer this quarterly if that's okay.
Fine with me. Any questions, concerns? Comments? Hearing none, let's move on to our last agenda item, which is agenda item number 13, approve and retain incentive plan for Health and Human Services employees.
All right. So I do have a presentation for you today. Last month, at the board meeting, a question was asked if I had considered retention or recruitment incentives to try to address our struggles with hiring and turnover. And that prompted to bring this presentation along with the proposal for today's meeting. Delving into this and making a recommendation that will improve our retention and recruitment was more complicated than I anticipated, and I think you'll soon kind of see what I mean as I share this information with you. So I know that all of you as our board know that we're experiencing a staffing crisis, but I do want to show you just how alarming it is. Last May, we provided a recruitment and retention report to the board outlining our struggles. At that time, we were concerned about losing 2 staff in late 2020 and then 4 more staff in the first 4 months of 2021. I think I gave that presentation in May. But as you can see from this chart, staff resignations got significantly worse the rest of the year. The second chart shows a 10-year history of staff turnover, which hit a record high in 2021. We ended the year with a 28% turnover rate, which is almost unheard of for the agency's history. So before proposing a recruitment incentive, it was not just recruitment, but retention incentive. It was important that we would be confident that whatever is to be proposed will be meaningful to our staff and have the intended impact. So to help with that, we conducted a brief survey with our staff to get input. A 5-question survey was distributed to our employees. There's a report outlining this survey results in your iPad folder, but I'm going to go over it here. 62% of our employees completed the survey. That's 45 people. The first question that we asked is, although all of these are important and need to be addressed, which is your top priority in order for you to remain with Health and Human Services? So 64% of the staff selected wages must remain competitive and allow staff to advance up all the steps. 38% or 17 staff selected health insurance must be affordable. The next question we asked is, if only one option were possible as a retention incentive, which would most encourage your continued retention at Health and Human Services? So 42% of the staff selected that a plan advancing along all of the steps of the wage scale. So that was selected over the retention bonus and improved vacation benefit options. I should note that staff were also offered an other category in which they could write in their ideas, but no other additional entries were made in the survey. The third question that we asked focused on the option of a retention bonus. So asking if a one-time retention bonus was provided, which option would you prefer? And 46% indicated a preference for rewarding longevity. Otherwise, the remaining were evenly split between everyone receiving the same bonus or making a distinction between full-time and part-time. And then the fourth question focused on the incentive option of making changes to the county pay plan, asking if a plan for regular step increases on the wage plan was approved, what factors do you think should determine when and how staff would move up a step? So more than half, or almost 2/3 at 60%, indicated that a change to the pay plan advancement should reward longevity. And then finally, staff were asked in an open-ended format to provide their ideas for incentives. So in the subject area of wages, staff comments indicated that increases should happen annually or regularly, longevity should be rewarded, and pay should be comparable to surrounding counties. Under the topic of insurance, comments stated that insurance needs to be more affordable, both for the premiums and the deductibles, and the quality of the plan should be improved. Related to bonuses, comments indicated that bonuses are a nice reward, but bonuses are short-lived and might not be the right way to go. There was mixed comments on whether the bonuses should be based on longevity, performance, or just given. And then related to vacation, comments focused on the need to improve the vacation and be more comparable to other businesses. So I'm going to present options that primarily focus on retention. Although recruitment is definitely a concern for us, I think that maintaining our existing staff is the most important place to start. And if we have a solid retention strategy, it will also influence recruitment, letting candidates for jobs know that what advancement would look like in our system. So taking into account the feedback that we received from our staff, as well as looking at the retention efforts that were implemented at Pine Valley, I'll show you some options that I think warrant consideration, and then I'll share my recommendations. So first I want to share with the board, make sure you're aware of the actions that have already happened and been implemented for Pine Valley. In September, the county board adopted 2 resolutions addressing incentives for Pine Valley employees, in addition to the recent action that was taken to raise the entire wage scale by 7% for both the general pay plan and the Pine Valley pay plan. The actions that were taken specifically for Pine Valley moved all employees up 1 step on their wage scale, and also provided an additional dollar per hour premium pay retroactive to the beginning of 2021 and then ending in August of last year. So with that understanding, I think the most obvious incentive options to consider for Health and Human Services would be to either provide retention bonuses, to provide a premium pay, or to update the pay plan with a wage step advancement policy that allows moving up all of the steps. I'm sorry, I think there's something else I wanted to share with you on this. I just want to make sure I covered everything. No, that's it, sorry. So with regard to a retention bonus, the staff survey had indicated about 31% of those who responded would prefer a bonus as an incentive. This slide shows two bonus options, one based on longevity and one based on full-time, part-time status, regardless of longevity. So if a retention bonus were to be provided, 46% of the staff from the survey preferred that the amount be based on longevity, with more being given to staff with more years of employment. So here you can see the two bonus options would cost between $90,000 and $93,000. As a comparison, when Pine Valley gave their premium pay to employees, the total cost was $150,000. That amounted to about $1,300 to each full-time staff. The advantage of a retention bonus to staff is that it's only a one-time financial impact to the Health and Human Services budget. So we would not need to determine how to cover an ongoing expense in coming years. The disadvantage is that it may be forgotten as time passes. There were a couple comments in the survey to that effect. Another perhaps more significant disadvantage is that it's extremely administratively cumbersome for our payroll system and our payroll staff on the back end to do all of the required accounting for bonuses. The county administrator has discouraged the bonus option because of this, and I will not be recommending a bonus option for the same reason. Offering premium pay is similar to a bonus, except it's given as a supplement to the staff hourly wage and is therefore provided over time instead of a one-time payment. If done like Pine Valley, it would be time limited. The advantage of providing a time limited pay plan to the staff, like a bonus, it has only a one-time financial impact on our Health and Human Services budget. We would not need to determine how to cover ongoing expense in coming years. It's easier to administer in our payroll system. The disadvantage is that it does eventually end, which could cause disillusionment among staff if there's not another incentive to stay with the county. Here you can see the two premium pay options. One would add $1 per hour to the wage of each staff, similar to what Pine Valley did. The second option shows a more conservative 75 cents per hour premium pay. You'll see later that the $1 per hour premium pay is our recommendation as an incentive plan, and I'll explain that a little bit later. The other way to go with incentives would be implementing step advancement on the wage scale. The staff survey indicated 42% of those, that was the highest amount of staff who responded, would prefer that the pay plan allow for advancement up all of the steps. So here are two options for advancing employees on the pay plan. The first option is to just follow what Pine Valley did, which advances all of the positions by one step, except of course for those who are already at the top step. The cost of this option is approximately $102,000. The advantage is that everyone gets an increase this year. The disadvantage is that it does not address the feedback about rewarding longevity. Staff who have been employed for 2 years will end up earning the same as many of the staff who have been here much longer once everybody hits that 2-year point. The next option focuses on rewarding longevity. The starting probationary and 2-year steps remain the same as our current policy. But this option would allow employees to advance a step at 4, 6, and 10 years of employment as well. So that would move them up along the wage scale. All of our current employees would be placed on the step that matches their years of employment with this plan if it were implemented. The cost of this option is about $122,000. You will see later that this longevity pay plan is also included in our incentive recommendations. In order to show you more detail about what the impact of these plans would be on our staff, I want to review some information about our current plan. So if you'll entertain me for a moment to give you a little bit of background. So in 2017, the county board retained Carlson Detman to conduct a wage study and recommend a pay plan for the county. And that was adopted in January of 2018. Now, there are basically 3 types of pay structure options. Step-based model where employees advance on a regular basis. That's what we have. A performance-based model where every raise is based on employee performance. So there's no increments in this plan. And then finally, a combination of steps up to the control point and then performance after. So all structures use something called a control point, which is considered to be the median market rate for that level of job. The control point shown here is marked as CP, so that's the median or the middle mark. So after reviewing the Richland County positions and comparing our positions to comparable jobs in nearby public and private sectors, Carlson Detman recommended adopting a step plan with 8 steps to the control point, but no movement beyond the control point. And this was because that it was felt that the county could not afford to go beyond the market rate at that time. So this slide shows Carlson Detman's recommendations for the pay plan that were made at that 2018 county board meeting. And as I said, the recommendation was to adopt a step plan with 8 steps up to the control point with no movement beyond that, at least in the short term. And then the standard implementation would be for employees to progress through the steps on an annual basis. It was also recommended the county conduct an annual review of the wage scale, including reviewing changing market conditions and changes in cost of living in order to keep the scale competitive. It was also recommended that opening up the steps beyond the control point should be considered in a few years. The implementation decision by the county board was not to follow the standard annual step increases, but instead to implement the plan based on what the county would be able to afford to do. And at that time, the county board decided to advance a step every other year. So the county board approved all employees advancing a step at the beginning of 2020. There were not advancements in 2021 except for Pine Valley's pay plan, in which everybody advanced a step this past September. And then, of course, beginning this year, the whole wage scale was aged based on the consumer price index over the last 4 years, but there was not a step advancement. So the current pay plan policy for general county employees, so not talking about the Pine Valley wage scale, which is separate, will impact our staff kind of as follows if nothing else changes. New hires will start at step 2, that's what we've been doing, and then move to step 3 after completing probation, and then on to step 4 after 2 years of employment. Steps above step 4 are not used unless a staff person happened to be placed at a higher step when the plan was first implemented. So this year, 6 of our current staff at Health and Human Services will advance to step 3 after their probation period is completed, and 4 will advance to step 4 after they reach their 2-year anniversary. The remaining staff will not advance a step unless other action is taken sometime during the year. So now I'd like to show you what would occur with each of the wage step advancement options that we're presenting. So this slide shows the impact of following the Pine Valley example and what they did with the Pine Valley pay plan. This will essentially move every employee up 1 step on the wage scale from where they are currently placed. So this plan restricts using the steps above step 5 unless a staff person happened to be placed above that already. Here is the impact of this plan. There are 10 staff who would advance in 2022 based on our existing policies. So those are the probationary staff and the staff who have that 2-year anniversary. All other staff except for 2 who are currently at the top step would advance up 1 step. The cost of this plan would be little less than $102,000 in 2022. For Pine Valley, the cost was $110,000 just for the remainder of 2021, and then was funded by the new Medicaid rate increase. That was funded by the new Medicaid rate increase, and then the 2022 cost for Pine Valley was included in their budget. The advantages of this plan is that everyone advances a step this year. The disadvantage is that this does not address the feedback about rewarding longevity. What will happen when an individual has been employed 2 years is that they will earn the same wage as those who have been employed much longer. So longevity does not get rewarded beyond 2 years. This slide shows the impact of a step advancement plan that rewards longevity. New hires would start at step 2 and move to step 3 after completing probation, and then up to step 4 at 2 years, the same as our existing policy. Employees would continue to move up a step at 4, 6, 8, and 10 years. So this opens up the whole scale. This proposal also depends upon an annual cost of living increase to the whole wage scale, like we did this past year to catch up over the last 4 years. So staff would see an annual increase in their pay if the cost of living does increase. So the wage scale would get adjusted on an annual basis. And this proposal also includes giving department head the authority to place employees up to step 5, similar to what Pine Valley did this past September. But it would also give the county administrator authority to approve any higher placements. The advantage of this option, a longevity plan like this disperses staff more quickly up the wage scale based on their years of employment. And it will take less time for employees to reach the market rate for their job. Implementing this plan would involve placing our existing staff on a step that matches their years of employment with the county. The disadvantage of this option, not all staff would get an increase this year. 48 staff would advance up the wage steps in 2022. 21 staff would not advance a step this year. But remember, if the cost of living adjustment is done every year, all staff would see a wage bump like we did this year. Other disadvantages that, well, I do want to point out, so then about 16 staff will advance in 1 to 3 years based on where they are with their years of employment. 2 staff are at step 8 already and would not advance unless the scale is opened up beyond the control point. So the other disadvantage is that this option is also more expensive than the Pine Valley plan. So now the question is, how do we pay for any of these plans? So this table shows the funding that could be utilized to cover the cost of each incentive option. So you'll see on the left, on the first line, savings from vacant positions. There are 6 positions that have been vacant for months. Each vacant position does not translate into 100% savings of that position expense. And that's because there would have also been revenue generated by some of the positions that would offset their total expense. So that means that the savings for each vacant position is different based on any revenue or funding that might be associated with it. The amount shown here is based on these 8 positions remaining vacant for 8 weeks. Under the next line of funding sources, claimable federal funding line, when there are additional expenses in certain programs with economic support in the ADRC, we're able to claim a percentage of those costs that exceed our allocations, and we are able to capture federal dollars, 50% of our costs in some cases and less in others. So the amounts in this line vary because each incentive option changes the expenses that we can capture for these federal funds. And then the next funding option would be to draw upon the ARPA funds. The request would be to cover the remaining expense using the American Rescue Plan Act funding that's earmarked for essential workers. So ARPA funding, Richland County received $3,350,000 in ARPA funding from the federal government. And on August 20th, the Finance and Personnel Committee earmarked 10% of those funds, or $335,000 for premium pay for eligible essential workers. Pine Valley utilized $112,000 of the ARPA funds for the Pine Valley premium pay in September. That leaves about $222,000 remaining in that category. Recent guidance from Wisconsin Counties Association indicates that all government employees qualify as essential workers. So here's my recommendation based on what I think would serve as an incentive for recruitment and retention. Ultimately, the management team and I think that the best incentive is to establish a comprehensive pay plan policy. This is that's consistently updated in order to keep up with the cost of living, that rewards staff for their years of service and lays out a plan for advancement up the steps. This would allow all employees the ability to see how they will progress if they remain with Richland County. And ideally, a plan would also allow for making exceptions to place employees at higher step if they have exceptional experience or qualifications. Now, we understand that establishing a policy like this that affects other departments will require involvement by the other department heads, as well as support from the county administrator and the Finance and Personnel Committee before it could ever go to the county board for consideration and adoption. And that would take a fair amount of time. So in the meantime, I would propose that we offer a premium pay to Health and Human Services employees for the remainder of the year, or until the county implements a policy for a pay plan that rewards longevity and allows for utilizing all of the steps. Premium pay would serve both as a recruitment and an incentive option to new employees, and a retention incentive to our existing staff. It would be given with the understanding that it would only extend to the end of the year, or possibly it would end sooner if the pay plan policy were implemented to reward longevity. So it would have to be done with that understanding because it couldn't continue on indefinitely. All right, well, does anybody have any questions? That's all I have for the presentation. And thank you for your patience through that.
Well, I have a couple of questions. I guess bottom line, what as this board could we actually do? I see you said, you know, approving the premium pay potentially. I would assume that would still have to go on to finance and personnel. Obviously, for a countywide pay plan change, I mean, we could recommend they look at that, but we're not going to be able to actually officially do that. So I guess, can you just state clearly what you're asking from our board for today?
Yes, thank you. You're right. Anything that's recommended by this board really is going to have to go through a couple of other steps. When it affects finances the way this does, it would have to go to the Finance and Personnel Committee, and then on to the county board. So what I am asking, in your board summary sheet, I've got 3 possible motions, and it's the top 2 that I would be asking you to consider approving. So the first one would be to approve providing the $1 per hour premium pay to employees beginning with the first pay period in February and ending in December 31st. But it would end if a comprehensive wage step advancement plan were implemented before that. And then, of course, this would have to be forwarded on to the Finance and Personnel Committee as well as the county administrator. And then the second thing I would ask is that this board recommend that the Finance and Personnel Committee develop and adopt a comprehensive plan that includes annually making the cost of living updates to the wage scale, outlining a wage step advancement policy for county employees that's based on longevity, and authorizing department heads to place employees up to step 5, and with county administrator authorizes higher placements. So it's those first 2 motions that I would ask this board to consider and hopefully approve. The third one there is if you really, if this board really feels like a different option that I presented to you makes sense, you could certainly make a different recommendation.
Thank you, Tracy. I just have a couple more questions. So for the first motion with the premium pay, immediate questions that come to mind is not that this is a bad idea. I like that idea. The unfortunate part of this is that, as you mentioned, all government employees are now considered essential workers. So how do we decide how to divvy up the rest of that ARPA funding to cover that? Would what's in the remainder cover for the rest of the county employees? I can see there being a lot of, you know, issue with that as far as fairness goes.
You know, there probably is not enough of the remaining funds that were earmarked for that specific purpose. So that $330-some thousand. I think if $1 per hour premium pay were provided to our Health and Human Services staff, they'd probably only leave maybe about $60,000 left in the amount that was earmarked for that. Roughly 10% of the ARPA money was also earmarked for public health activities. And we weren't sure at the time we asked for that if we would need all of that, or if there'd be funding available for all of the contact tracing work and all of the vaccine work that our public health is doing. But the state has been giving us additional allocation to do that. So I'm anticipating that we won't need to tap into all of that ARPA funding. I think some of it needs to be preserved because we don't know what's coming in the next couple of years, but we know we're covered for this year. And we think into 2023, the state is also allocating special funds for that. So one possibility is that some of those funds might be released to go toward premium pay for other county employees. And that's just my thinking. Just how I'm looking at it, but.
So, okay. So when you say on the summary part here, that in order to cover the ARPA funds, it'd be 103,000, or that's how much you would be utilizing in order to cover, I'm sorry, premium pay. But you just mentioned that there was a 10% that was earmarked. I'm a little confused by what you're saying there. Do you think that it's going to be less than that 103,000?
No, what I'm saying, I guess, so I'm just kind of showing you the part of the handout that focuses on the dollars. So the premium pay, I think we're pretty close on the estimate, will cost $166,000 for Health and Human Services, and we would need about 103,000. So the Finance Committee earmarked 10% of that $3 million for essential workers. They also earmarked a second 10% for public health activities. And I guess what I'm saying is, I'm not sure that that additional 10% is going to be needed by public health because the state has come through with additional funding for all of these extra expenses and activities that public health is doing. So it may be an option for the Finance Committee to adjust that other 10% earmarked for public health down a little bit and then add that into what's earmarked for essential workers. Is that getting?
That would be 300,000 as well?
Yeah, so yeah, 10% would be 335,000.
Okay. I guess those are some questions I'd kind of like to hear a little bit more about, but okay, sorry, I know I'm kind of monopolizing the conversation here, so I apologize. One more question before we go back to that motion. On the second motion, where you talked about forwarding a recommendation that Finance and Personnel look at the comprehensive plan. In your talking with the county administrator, I was under the impression, are they not already doing something similar to that, or at least looking at that, or wanting to?
I hope they're wanting to. I am not aware of any work that's being done on that. I did have a conversation with the county administrator prior to putting this presentation together and letting him know that I was going to be doing this. And really the only feedback I got was more related to him kind of steering us away from a bonus option. So we didn't talk specifically about the pay plan in that sense. And so I'm not aware of other work that's being done. Perhaps there is that I'm just not a part of, possibly.
And if I may just add just two pieces of information. I know that with ARPA funding, we've looked at hopefully trying to promote public health workforce and infrastructure. It's been woefully underfunded for years and years and years. So, and we've done without, no offense, we were kind of caught underfunded and understaffed when this pandemic began. So the need to maintain the infrastructure and the workforce of public health is essential. So I have to advocate for that. And I also have to indicate too that when Pine Valley's request was approved, Again, we had to also look at how much funding was available for essential workers at that time as well. And it's almost like the first person who comes in, might get funded, but then the other folks who come in later might not. So just in the interest of fairness and a precedent being set, I would just like to have you folks just take a closer look for us as well, because it's a precedent has been set for workers here in Richland County already.
On that note, though, wasn't there some funding coming directly from is it Medicare or Medicaid? I always want to get that mixed up. That was utilized in their wage increases?
Yes, a portion of it was. I think they used about 112,000 of the ARPA funding, and the remaining was some increase in Medicaid funding that the nursing homes were getting.
Mr. Chair, in general, I am not in favor of creating a different scale for individual departments. That's agnostic to Health and Human Services or Pine Valley. However, working in healthcare, I do know that there is special considerations for healthcare workers in the current climate, and that includes human services as well. And I think studies have shown that the next 3 months are going to be crucial as the Great Resignation continues and the pandemic seems to be burning a little hotter than it has in the past. There's a lot of folks that are leaving these sectors of the workforce with no immediate plans to come back, and that's just the hard facts. So I would like to consider a wage scale for Health and Human Services that acknowledges that, but by and large, I'm not. That wouldn't be my first choice. I would put it on the county to do something about the wage scale in general for the disparities that could create, as Ingrid kind of alluded to. I personally would like to see, and what I know some other healthcare organizations are doing, is more of a commitment bonus. And know the administrator has mentioned he's not in favor of a bonus for the paperwork that's involved. I don't know if I care much about that right now, being honest. Like a 3-month commitment, bonus pay upfront, and a commitment to stay until April or some other date yet to be determined. I think there's a lot of precedent around the area to do things like that. It gets cash in the pockets of folks right away, thanks them for their service, and we can plan for the next quarter or so on retaining that workforce. So 2 separate options, attacking 2 different things, I guess, but I would be more in favor of seeing something that was commitment driven.
Is there any other discussion? Comments or concerns? So right now, before the board here, there's a series of 3 motions, I guess, that are recommendations. What recommendations should we, or if any, should we move on to finance and personnel? Trying to find this, where it is. So what is the board's pleasure? So in one motion is to provide $1 an hour premium pay to employees' wages beginning at the first pay period in February and ending December 31st of 2022. What is the board's wishes on this motion? To forward this on to finance and personnel, let them discuss this even more, and then we could be at finance and personnel and talk in more detail with this?
Tracy, do you plan on, I'm sorry, Mr. Chair, would you plan on talking about that potential, you mentioned changing the way that things are earmarked, if option 1 was forwarded to finance and personnel?
Yes, I would want them to know that that we feel that 10% earmark just for public health activities. I don't want to discount anything Rose said, because I think what we're both talking about is how do we maintain our workforce? And so kind of shifting that to help with maintaining the workforce. So yes, I would talk about that as an option.
So is there anyone willing to make a motion to just forward on the finance and personnel to approve $1 an hour premium pay?
Mr. Chair, does Rose feel that she has the adequate funding, that 10% that you're recommending be reallocated to the premium increase would be okay with public health?
You know, I'm a generous person, and my court done a lot to support public health here at Health and Human Services. Again, I'm just, of course, just trying to protect, you know, as to whatever degree I can, just resources, of course. Would I consider having some of that funding support our folks here at Health and Human Services? Yes, I'll go with that.
Mr. Chair, I would make a motion to approve $1 per hour premium pay. Basically as it's written there, exactly how it's written in the first paragraph. I additionally feel passionate about the bonus for a commitment. But I would, what's your recommend? Okay, no, I make a motion for the first paragraph and I will comment more later.
So we got a motion on the floor right now by Supervisor Gottschall to approve providing $1 an hour premium pay to employee wages beginning the first pay period in February and ending December 31st of 2022. And that this motion be forwarded on to the Finance and Personnel Committee and the County Administrator for further discussion and possible approval. Is there a second? So there's a second by Supervisor Glassberger. Is there any discussion?
Again, I just want to state that with the understanding that, as Tracy has said, she's going to be discussing the possible options with the ARPA funding as it relates to other employees too.
Is there any other discussion on approving the $1 an hour premium? Hearing none, all those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. I'm in favor of another motion being made to recommend finance and personnel develop a comprehensive plan that includes annually making the cost of living updates and the wage scale outline, which I think finance and personnel is already doing. But I also think that it would be nice to have it come from this committee to them to encourage them to do a little bit, work at this a little harder. Not that they already are, but what is the board's feeling on this second possible motion that's before us here?
So are you making the motion then?
I don't really want to make the motion, but I think it would be nice that we could have something formal go to finance and personnel. We need to do something as a county as a whole, and not just by department, because it does create a lot of animosity between other people and departments. But we need something looking out for the best interests of the county as a whole. I think that this second motion would probably be better than anything.
Yeah, I agree with that, and so I would therefore make the motion that this go on to the county board.
We had a motion by Dr. Barris, and the motion would be, is there a second?
Van will second.
And second. So the motion that's on before us today, it's on the floor, is to recommend that Finance and Personnel Committee develop and adopt a comprehensive plan that includes annually making the cost of living updates to the wage scale, outlining a wage step advancement policy for county employees based on longevity, and authorizing the department head to place employees up to step 5 with the county administrator authorized to approve higher placements. So that is the motion that's on the floor here right now. Is there, and we do have a second, is there any other discussion?
I guess I would just like to add with that I think it's important, which Tracy is always very thorough, but I think it's important when this gets presented. I think that background information, Tracy, that you gave us on the percentage of turnover that we've had this year particularly, as well as what Tim Gottschall was referencing as far as the crisis that's hitting health and human service workers and other healthcare staff. I just think those are important pieces of information to really kind of alert or help inform Finance and Personnel Committee on how dire this situation is and can be. I mean, like you said, I think they're already working on that. I know that there's a lot of considerations, but I just think that information was really good, Tracy.
Thank you. Yes, definitely.
Any further discussion? I'll call for a voice vote. All those in favor of the motion that's on the floor signify by saying aye.
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 Those opposed, say nay.
Mr.
Motion carries. Go ahead.
Sorry, Chairman, Mr. Chair. I think Tim left the meeting. Do we still have quorum? I can't remember how many of us there are.
Yeah, we have enough.
Okay, and then I don't know, he was the one who had talked about wanting to make a motion as far as a commitment bonus. So I don't know if that's something we'd want to revisit later or at a different meeting, because I don't really have, I don't know how to, I can't speak for him, obviously, and I'm not sure what that would look like.
Yeah, that's something that we could talk about at another time. Discuss on that. I'd be in favor to discussing that anyway. So it looks like we've reached the end of our agenda. Comes to number 14. Is there a motion to adjourn? I would make that motion for adjournment. Will there be a second?
Second.
Seconded by Ingrid. All those in favor signify by saying aye.
Aye.
Aye. Opposed, say nay. Motion carries. Thank you, everybody, for attending today.
Thanks.
Bye.
Right.